kind of weekly assignment sheet, and this is what it will look like every week, but usually you guys will get it on Friday. This week's a little bit different because of Labor Day, but you can see all of your new terms. Okay, you'll have 10 new medical terms every week, and then at the bottom you can see your 5 abbreviations. So make sure that you don't forget about the abbreviations as well. And we'll talk about those in just a second, and then it gives like what we're going to talk about today, if we're going to use the book or whatever, and then if you'll go on the back, you can see what we're doing every other day. So tomorrow we're going to look at our healthcare service agencies. Tuesday, we're going to talk about insurance. Wednesday, you'll talk about your agency during class. And then Thursday is the payday, which remember is the quiz over your terms. So that's what that payday means. Anyway, so that just gives you kind of an idea of what we're doing. So if you're absent, you at least have something to look at and see what you missed. And then you can either look in the absent box up here and grab what you need, or you can come to me and ask for us to get it situated. And then also that way you know what's ahead and all that good stuff. So, any questions about that? Okay, let's talk about your payday terms really quick. Insurance. Whenever you think of the word insurance, what do you think about? State Farm, okay. What does State Farm do? What about your car insurance? Why do you have car insurance if you guys have car insurance?
Helps saves money.
It what?
It helps saves money.
How does it save money?
If you get in a wreck, it helps pay for some of it, or most of it, depending on what insurance you got.
Okay. Yeah, it saves money if you need it. It doesn't really save money if you don't need it, but you have to have it. At least car insurance, you have to have at least liability insurance. What about health insurance?
You have to have that.
You don't have to have it.
I thought they passed a new law that said you have to.
I don't think that's actually passed yet, but that's what they're working on. That's what everybody keeps talking about, Obamacare, it will require everyone to have insurance of some sort. Insurance is just something that you pay into that helps to pay whatever cost that you accrue, like for health insurance. So I pay, like every month I pay a specific amount of money for insurance just in case I'm gonna need it, basically. And that's the same thing for any insurance. That you get life insurance, you pay in every month just in case you were to die, and whoever you have as your beneficiary is gonna get your insurance. Is gonna get that money, so. An epidemic, this is just widespread disease in a specific area. Any of you guys watch Outbreak? Was it Outbreak? Is that the recent movie that came out? Yeah. That was like an epidemic. That was kind of a massive epidemic. You can have smaller epidemics, like West Nile is, I don't know if they've considered it an epidemic yet, but it's on its way there if they haven't. Okay, treatment. This is what is done or given to a person to help their condition or their disease. Medication is a type of treatment. Physical therapy is a type of treatment. Anything that you're doing to try to help them get through that. Okay, a provider. This is just someone that provides medical assistance, like a physician. You can call them a provider. Cooper Home Health is a provider, somebody that provides a health service. A physician is just a doctor. So you'll usually hear me say physician, and let's see. Geriatric is pertaining to the elderly. That GER at the beginning, that means like aging or elderly people. So like geriatric care, that's care of the elderly or older people. Hospice is a specific type of healthcare that's given to people when they're near death. Usually they have to have like a living or a life expectancy like 6 months or less. So that's given at the end of that. Now, does everyone have that? No, it's they can choose to have that, and their insurance usually will cover it. But it's a very specialized type of medical care just for that purpose. Ambulate means to walk. So have y'all ever been to a hospital and it says like ambulatory care or ambulatory services or whatever. It's more like a clinic. Ambulate means to walk, so that means you're just coming in, to like a walk-in type of thing. Resident is a patient in a nursing home or assisted living. I was advised last year that they don't like to be called patients, they like to be called residents. So, anyways, when you hear that term, a resident is just a patient in a nursing home or assisted living. And then rehabilitation, this is just the process of the regaining of either mental capabilities or physical capabilities, or it's learning how to live with the disability. You probably heard that word before. Rehab is the short term for that. I always think, when I think about rehabilitation, do you remember a couple years ago when they had the shooting at Fort Hood? Probably been 3 or 4 years ago. I actually had a good friend that I worked with whose son was shot at Fort Hood, and actually had some of the worst injuries. Anyways, he was in, I think he may still be in rehab, but he was in rehab for a year or 2 after that, because he was shot like 4 times. I always think of him when I think of rehab, because he had to work so hard. They did a big special on him on the news. PRN means as needed, and I know that you think PRN, how can that mean as needed? But a lot of these terms and abbreviations that you'll hear are from old Latin words, and so that's why they have such weird abbreviations. Sometimes they're weird meanings. So PRN is as needed, and you'll see that one a lot. Rehab, we just talked about. EMS is emergency medical services, like an ambulance, EMS. MD is medical doctor, and then VA is Veterans Administration. You'll see why everybody know what the VA is? Veterans Administration. You may not know. VA is a hospital system. It's healthcare for people who have served in the armed forces of some sort. But it's a federally funded. Like there's a big VA hospital in Bonham. So, anyways, those are your terms. And we'll get started. Okay. And you guys can follow along. We'll just discuss this with your PowerPoint. So how available is healthcare? What do you guys, when you hear that question, what do you think? I mean, how available is healthcare for us?
Depends on your job.
Okay. Maybe if you're insured or not. How available do you think healthcare is for us, maybe in comparison to the rest of the world?
Not very.
You don't think so?
All of Europe, they're required to have health cards. Asia, most of the continent is required as well. It's only South America and Africa that aren't required, while here, you don't get it unless you're under any certain conditions.
Okay. I think there are all of those. A lot of like the more socialist type of governments do require some health care. But what do you think when, in some of those countries, what do you think happens to the quality of health care?
It's probably not as good.
Potentially, maybe not as good. Probably depends on the country and what kind of infrastructure they have. I know, and when I was in Ethiopia, we would have people, I worked in a clinic, and we were a 2 days drive from the nearest, not from the nearest city, but the nearest like large city that had businesses and things going on. So it took 2 days driving to get to where I was. And on the way back, you couldn't even drive. I had to walk part of the way because the roads were so bad, because it was rainy season. But there would be people who would literally walk for 2 days to get to the clinic to get help. It was crazy. I mean, they would carry their family members for 2 days, carry them on stretchers, so that they could bring them and get help. And so sometimes I think that we take for granted how accessible healthcare really is. I mean, anybody, if you have an emergency, and you don't have any insurance and you go to like a local emergency department, they have to treat you. You may not know that, but they have to at least get you stable, before they can release you. And so, we have, I mean, that's not gonna help if you've got a cold or something like that, but if it's anything emergency wise, they're required, I mean, they have to, by law, they have to at least get you stable. So, it's easier if you have insurance probably, or if you live in an area where you have some other hospitals that accept a lot of people without insurance. And we have hospitals that do that as well. Okay, how? Okay. Let's see what we are. I don't think that's good for the pen. Okay, so you guys may not always be aware of this, but any kind of government health care services are paid for by taxes. Your family pays taxes every year. If you guys ever worked and had a paycheck, like an actual paycheck, any of you guys? And it's got all the taxes that are taken out. Kind of makes you sad, doesn't it? Because you think, oh, I'm going to go and get all this money, and then you have a big chunk of it taken out for taxes. But all of that goes in to pay for things like Medicare, which is insurance that you get when you're older. Medicaid, which is insurance that is for people who are under a certain income level. It pays for some of the state hospitals or county hospitals, and you'll pay in for that. Your local health department, the state health department, all of those things, taxes help to fund those. And then you have some that are privately paid for, so people like hold stock in those particular areas, or companies, hospitals, that kind of thing. And then industrial, obviously, well, this is really talking about taxes, like we pay private taxes. And then in any kind of business, they pay taxes too, and it helps that. Which is part of the reason our county, we don't have any big businesses in our county. We don't have any just major, like large employing companies. And so as far as what our county brings in tax-wise, it's really up to just the citizens of the county. Makes it kind of hard to be able to provide some of the things that other counties are able to do. Local health services, city, county health department. So ours, I believe, is in with Lamar County. We would go to Lamar County Health Department, and I believe is for us. But Hunt County has a health department, Lamar County, Hopkins County, and they offer, a lot of the health departments will offer different immunizations. And actually, usually they're cheaper there than if you go to your doctor's office. When we went to Africa, we had to get several, so that was where my husband went. City or county hospitals, if they are labeled county hospitals, they take everybody within the county. They have to. Parkland, anybody ever heard of Parkland in Dallas? Big, huge hospital. It's kind of crazy in there. Yeah, there's lots of crazy things that go on there, but anyways, that is like the hospital in Dallas where basically anybody can come. They always accept Medicaid, they accept regular insurance too, Medicare, but they also accept lots of people who are who are uninsured, excuse me. And then senior citizen centers, so we have tons of those are in this area too. Okay, state health services. These are just listed out, some that we have. Texas Department of Health. And if you guys ever need some information, like you want information about what shots you need, or even just like, just everyday stuff, you can always go to the state health department website, and there's tons of resources on there. State medical centers. state mental health hospitals, and I'm not even sure anymore where the state mental health hospital is. Terrell used to be, and I don't know if it still is or not. But mental health hospitals are strictly for that purpose. You go there and they'll have they may have a ward for people with schizophrenia and a different section for juveniles with mental disorders, and a different area where, people are in drug rehab or whatever. But those are all offered, and if it's a state hospital, then it's paid for with taxes as well. Texas School for the Blind is just a resource for people who are blind. They help people get into schools. They help with resources. They'll send books in Braille, or they have all kinds of stuff. Same thing with the Texas School for the Deaf. And I know one time when I was doing home health, we had a patient who was blind, and they sent books on tape. They had some things readily available, so we just call them and say, what do you have? And they sent books on tape to the patient. So, and that's what they are there for. Okay, federal health service. Does everybody know the difference between federal and state? Federal means it's the whole United States, like the United States government is federal, whereas state government would just be Texas. So federal health services mean they're covered by the U.S. government. Okay, so we have U.S. Public Health Department, again, tons and tons of information. You could say, let's say you wanted to take a trip to, Madagascar, okay? You can go in and look up, they have a travel site on there, and you can go in and look up, and it'll tell you exactly what shots you need to have if you're going to Madagascar, and what you need to watch out for, and if there's been any epidemics there, or, you need mosquitoes or malaria or whatever. The VA hospitals, like I said a while ago, that's for people who've served in the armed forces of some sort, and the VA hospital will handle all their care. Like, they can go there for all kinds of care. And then the Center for Disease Control. Any of you guys did see Outbreak? The CDC, probably heard of that term before too, but that was, all those people work for the CDC. In that movie, not Outbreak, what was it called?
Contagion?
Contagion, thank you. Outbreak is an older movie. Contagion's the one I'm thinking of.
It's disgusting.
I thought it was a good movie.
I thought it was too, it was gross.
Is it the one with the little rat?
This one had that.
No, it was like, they got really sick looking, and their eyes were red, and then they would just spit up foamy stuff and die. But
Because
it
that
was
guy in the
something in
plane
their
brought the
brain.
experiment in to the plane. And this little rat or whatever started biting someone in the head, and then,
Oh, no, this isn't that
is
one.
that another one?
I don't know that one.
Cause
Yeah.
it is, somebody gets red eyes, like little chubby guy or whatever.
This was on,
It's like,
bats.
is that what
It
it
was
was?
caused
Oh,
by
yeah,
bats.
it was.
An Outbreak is the movie with, Dustin Hoffman. And it's caused by monkeys.
There's a disease that's caused by monkeys.
Well,
I
they
know what
carry
you're talking
it.
about.
They carry it. It's a good movie too.
I actually like that.
We watch it up here, except I've gotta find a clean version, so anyway. But, Center for Disease Control, they're the ones that handle the outbreaks and the epidemics, and you guys are probably too young to remember, but, when I was in high school, I know y'all be too young to remember that, but, there was this big anthrax talk, and you still hear about it sometimes. It's like this white powdery substance that is supposed to be like a biological weapon. You know what that means? Bioweapons are some kind of disease-causing agent that they might, like a biological weapon, they might spread it over an entire area to cause mass, sickness, and they use it as a weapon. But, so anthrax is considered a biological, or I guess at that point anyways, was considered a biological weapon, and something that they thought terrorists would use, and so, anyways, there was always this big anthrax scare. Well, the CDC would be the ones that handle that too. but I think they're the ones, that come in and, like if somebody's really contagious, they'll wear like the big suits, the big space looking suits and House. Y'all watch House? Or did y'all ever watch House?
I used to.
They had an episode one time, I will talk about TV all year long, but, they had an episode one time where it wasn't smallpox, but it was something like smallpox. Hemorrhagic fever or something that was really contagious, and they had to wear like the big suits and go into the rooms that are enclosed in like zippered plastic,
Scare me.
Do it.
They kinda scare me, the suits, kinda scare me.
Yeah, they would be scary if you were the patient. You're like, yeah, those would definitely be scary. Healthcare facilities. Okay, so these are just where you go to get healthcare. So hospitals, obviously, hospitals have different units. You have a labor and delivery unit or a nursery, and you've got the X-ray department. You've got what else? Medical, surgical, surgery, whatever. All kinds of different units in the hospital. But there's different types of hospitals. There's the religious hospitals, like you'll hear, like Methodist. Harris Methodist. No, not Harris Methodist. Anyways, Methodist, or a lot of times you'll hear Catholic. There's a lot of Catholic hospitals. What else? Baylor is considered a religious hospital. I'm trying to think of any others in the area. But, anyways, usually with religious care, they'll have a specific, they may take people with insurance or they may take anyone, they'll specify. But they usually give care within like the borders, I guess, or boundaries of that religion. So, for example, depending on what they believe, that hospital may not offer, like abortion services, or they may not offer, something that goes against their religion. They may not offer those particular services. Okay, private hospitals. These are the ones where people actually put stock into the hospital, so they buy into the hospital and they make a profit. So, if I buy stock there, I expect something to come back. And usually private hospitals will only take people with insurance and probably don't take Medicaid. Non-profit means that they're not making any profit, okay? There's no shareholders. There's no people who buy stock in it and then expect to make a profit. It runs on what it makes between insurance and whatever kind of insurance people bring in. And they may set up a private pay thing where people can pay it out. Government organizations, like we talked about, VA hospitals is an example of that. And then specialized. You'll sometimes see specialty hospitals. Like at Baylor, there is a cardiac hospital that just does heart stuff. Their children's hospital would be specialized. So, anyways, those are just some examples, specialized. Okay, long-term care is exactly like what it sounds. It's long-term. Nursing home would be considered long-term care. Rehabilitation, a lot of times, is long-term care. So those are people who are not stable at home, need to be in a healthcare facility long-term. Makes sense. Practitioner's office. This is just like you go to a doctor's office and they have their own practice or whatever. That's just, a practitioner is someone who offers medical care. Clinic is usually kind of like the PCA. If any of you guys have ever been over there, or just any kind of the Silver Springs Medical Clinic. They'll have several physicians or a group of physicians in one area that all work out of the same office. Okay, a lab. Laboratories usually just take blood or take some kind of whatever their specimen is that they need, and then they process those. There's usually laboratories within the hospital, but there are labs that are out, like Quest Diagnostics. Have you guys ever had to go somewhere like that to get to get blood drawn or anything? There's one over across from the old Blockbuster in Paris. I know there's Quest Diagnostics there, but that's all they do. They just take blood or take whatever specimen they need, and then they get the results and send it back to the physician. EMS, emergency medical services, we talked about that some. Home health, and home health is just, usually it's done, paid for by Medicare, because most of the patients are elderly, but the doctor sends in, the information, we'll send the home health company information about the patient, say they need to have this shot every Thursday or something, and then the nurse will go out to see them, and then she or he continues to visit them at home. So there's lots of specifics that go into home health, and there's lots of paperwork to it. But it serves its purpose. Its purpose really is to keep people out of the hospital and out of the doctor's office and out of the emergency room. Because that, in the end, will save us some money. Okay, rehabilitation we talked about, but there are specific rehabilitation centers. And then hospice, like we discussed, is care that's specialized just for people who are usually have a low life expectancy at that point. So, any questions about any of that? Quiet this one. Okay. Let me go ahead and do one thing, actually, before we move on. This is what you guys are going to work on tomorrow. Now this says presentation at the top, but it's not a test grade, so this one's not a test grade. It was last year, but I'm doing that this year. Okay, what you guys are going to do is you will choose a healthcare service agency to research, and there's some listed on here. So if you guys know, if you already know one you want to do, you make sure we all do something different. But kind of get in your head what you might want to do. And then all you do is you answer these questions, and you can do it in an outline form or an essay form. Everybody know what outline is? Anybody not know? If you don't know, it's okay. Just raise your hand. I just need to know so I can tell you. Outline, anyone? Everybody know? You don't know? Okay. You do outline form. Okay. If you're doing outline, let's say you're going to do, oh, where's my paper? Let's say you're going to do, let's say you're going to do CBA. I doubt anyone's going to do that. It's called community-based alternatives. Okay, so I'll write my CBA at the top. I do need that paper, actually. Let's look at my questions. So what's the purpose of this department of agency? I'm going to explain basically what it is. Okay, so I know community-based alternatives is a program established for people who need additional service or supplies in their home. Okay, I'm gonna write it all out. Okay, I know that its purpose is to assist the aged or disabled in their activities of daily living, so their everyday activities. They put in, like, the CBA will go and put in showers in their home if they need help with, like if they need a walk-in shower, they will go in, they will build ramps at their home if they need a ramp, those are kind of things. So I list all the rest of their purpose. And then I go down here to the next question. The contact info. I'll put their phone number here. I'll put their address listed out here, and whatever their email or website, whatever. And if you have a local contact, I'd like for you guys to add a local contact. some of it's not gonna apply. I'm gonna go on to the third question. What kind of funding? I'm just gonna write down funding. And then I'm gonna put, this one's usually state funded through taxes. Okay, does that make sense? Everybody good on the outline? Do y'all call them something different? No? Okay. Well, anyways, so this is outline, so you can do it in outline form, or you can just write, like, if you wanna write a whole paragraph on the funding, and then write a paragraph on the contacts, or however you wanna do that, it's fine, as long as it's neat and organized, and I can follow it, okay? So, any questions about that? We will go, I will bring in the lab, the walking lab tomorrow, and we'll, whatever it's called, rolling lab on wheels, I don't know. We'll bring that in tomorrow so you guys can do your research on the computers. And then each question is 20 points. Oh, that's how it'll be graded. It's worth 20 points. As long as you answer everything completely and fully, one-word answers don't get 20 points. I'll tell you that. They get 1 point. One word and 1 point. Okay. So if you want your 100, it needs to be detailed and just answered thoroughly. So we will, for us, we'll read that textbook tomorrow right when we get to class, and it'll take just a second, and we'll go.